One thing that I really like about the Peterborough program is that you get to do your family medicine horizontally. So you're in your family medicine clinic 1 day a week for your whole 2 years, which really gives you that valuable continuity of care with your patients. But everything else we do in block format. So we really get to immerse ourselves in the other specialties that are related to family medicine. And that's sort of a unique structure. So that's something that's unique to Peterborough that I really like and suits my learning style.
Residents appreciate the opportunity to work one-on-one with experienced preceptors. So there are very few learners in Peterborough in comparison to the size of the facility. So Peterborough Regional Health Centre is a massive regional health centre. It's a brand new facility that was opened in 2008, and it's a 490-bed hospital. So you have the opportunity to have really high patient volumes and high patient acuity, but often our Peterborough Kawartha resident is the only learner on that rotation. So they're getting one-on-one teaching with preceptors, and they're getting a real wealth of hands-on experience through their hospital rotations.
Because you are the only learner, the attendings are very open to pulling you out and bringing you in to be involved in a case if they find it'll be an educational experience for you. I was working in the green zone, stitching someone up when a patient with no vital signs was being brought into the emergency department, which is a classic code blue scenario. So even though I was in the minor treatment zone, one of the docs came running out and just said, "Hey Abby, you want to be involved in a code? Have you run a code? Great, you're going to run this code." And so those types of experiences are pretty common when there's so few learners around.
We're fortunate in Peterborough that all of our family doctors are part of family health teams. So we were early adopters in Peterborough, and all of our preceptors are part of a family health team. So no matter which clinic a resident works in, they are working in an established family health team. So they have the benefit of being in teams with dietitians and social workers, nurse practitioners, pharmacists, and their patients receive that support. So that's an excellent learning environment in family medicine.
You start having patients booked for you maybe every hour, and then maybe you move to every half hour or every 20 minutes. So as you sort of get a little bit more comfortable and more competent, you can speed up a little bit, but they'll book you patients. Usually you see them and then review them with your staff, or decide sort of how to manage them, and you sort of over the 2 years transition to be more independent.
The preceptors who teach in our program are doing so because they want to be involved in teaching, and they love working with learners. So our residents are fortunate to be able to be with preceptors, both family physician and specialist, who really enjoy teaching and who want to take on that role.
One of the greatest parts about Peterborough in terms of work-life balance is that it's not only the residents who prioritize the work-life balance, it's also your own attendings. There's a reason they've left the larger academic centers. And I think that reason is they also seek to achieve a balance in their life, whether it's their social interactions, their work, and their family.
Peterborough is really great. It's a really nice size. It's sort of a medium-sized city, or a small city, I suppose. But it has a ton to offer. If you like the outdoors, if you're someone who's kind of active, likes being outside, it's a really great city to be in. Really close to Kawartha Highlands, close to Algonquin Park, tons of green space within the city, and you're outside of the city in 5 minutes if you want to canoe, cycle, hike, camp. Tons of stuff to do, just outside the borders of the city.
I think it is a nice feature for the community to have access to a free zoo without any entrance gates. You can walk through it or cycle through it. Peterborough also has a number of large green spaces because we're fortunate to be on the Trent Severn waterway. I think the city's done a great job at preserving green space in and around the city, specifically on the waterway.
It also has a really strong arts and music culture as well. I think probably part of having Trent and Fleming and having some university students around, it sort of has that flavor as well.
The Peterborough residents are a fun group. They are active together, they socialize together, they bring a real enthusiasm to the Peterborough medical community that has been a real appreciated boon for our medical community over the last 4 or 5 years.
I love interacting with people every day, like that we see patients every day, that we get to have a connection with them that is sort of unique. It's different than being a friend or a family member or a stranger. It's sort of a unique connection that you have with people, and you get to help them. And you have to figure out how to help them, and everyone's different, especially in family medicine. There's people who need medications and people who just need an ear to listen to.
People are open with you. They want to trust you right off the bat. And if you just listen to them and show them compassion for whatever issue it is that they have, they respond to that